that. It's a frustrating day to us when we have to come before you and talk about what we should be talking about inside the halls of Jackson with our leaders, working together. I think many of these caregivers worked last night. There's some patients here. Everybody cares enough. I don't think we've ever even had the cause to try and fill this chamber before. In my 27 years at Jackson, 30-some years as a nurse, we've come to the conclusion that Jackson is very sick. Patient lives are at stake. The caregivers at Jackson have been trying to work together to save our jewel for this community. Now, obviously, you know we've given the money, the $106 million last year, the $52 million for 3 more years, there's a total of $156. AFSCME's coming close to the end on their millions they're going to be given. We've hired Dwayne Fitch from Fitch Healthcare, who turned around Cook County to advise back when Dr. Wildon was here, worked with the current leadership team, actually sat and educated Mr. McGoy on the white paper, the roadmap to victory. And Mr. McGoy actually repeated all the elements of Dwayne Fitch's roadmap to victory for Jackson during his interview with Jackson for the CEO job. Our concern is that nothing's being done at Jackson. Nothing's being done to save Jackson. The layoffs, the diminishing census, the increasing wait times in our ER, the failure to open primary care clinics. We've even gone the opposite direction. When Commissioner Roll was here, he complained about 2 clinics being closed. We've privatized Penalver under Mr. McGoy's watch. We've not opened a primary care clinic on main campus yet. That was a recommendation from 18 months ago. That recommendation actually puts a primary care clinic on campus and shifts 25% of our patients from the ER, where we pay 5 times as much for them, shifts them to the more cost-effective setting and actually more pleasing, more patient satisfaction to be seen in a clinic. Still not done. That doesn't take money, that saves money. All these indicators are going in the wrong direction. I would argue you don't have to be an expert in hospital turnaround to know that successful hospitals out there, we have a couple in our South Florida, Baptist, Memorial, they're growing primary care clinics as fast as they can. They've been reported to put every dollar into primary care growth. That's the future, that's healthcare reform, that's cost effectiveness, that's quality, that's prevention. That's the way healthcare needs to go. We have a self-fulfilling prophecy going on at Jackson. Deny access, decrease volumes, decrease staff, and perhaps even decrease services. It's been argued we won't decrease services. If we try and do the same with decreasing the staff and the volumes and everything else decreases and we try and perform the same service, patients will be at risk. We're in a race to the bottom. This is not right-sizing, this is downsizing. The furloughs were a sneak preview of what the layoffs would be like. Management denies that any patient's lives were at stake. The FRB asked and management reported no increase in incident reports. The caregivers think otherwise. I just want to ask everyone in this room who's a caregiver, if you think that patient care was negatively affected with the furloughs, please stand up. Staff in the triage area, 3 were furloughed, 2 were there. It was a busy night. Patients died. This is not right. This is all of our responsibility. You know, I could go on. I'm not here to trash Jackson, but we have got to stand up for what's right. We have tried on the inside. We did this on top of crazy shifts. We did this after hours off the clock to make sure management had the data. We got explanations, oh yes, that was a system failure. 6 hours to see that patient when normally you do it in 15? You're right, that's a failure. You know, wrong answers. We need changes. You cannot take care of patients in the ER when you furlough 3 nurses out of 5. That's not possible when you have a busy night. You can keep your fingers crossed that those patients don't come in. The Institute of Medicine has a famous article you all should read from 1999 about the 98,000 preventable deaths that occur in in this country every year. Preventable deaths. The Institute of Medicine said we would save $1 billion in this country on health care if we would stop those preventable deaths. We're not focused on preventing deaths at Jackson. We're looking at the bottom line. We're going right to the bottom line. Patients' lives are at stake. These furloughs were a sneak preview. There has been no discussion with us. There was no discussion about us on the reporting. I want to know every day when these things happen, we need to know if these furloughs are pushing it too hard. Never asked. Never asked. We went to them, we scheduled weekly meetings, we had our caregivers give extra data, spend extra hours. This is heart-wrenching. In December, when the furloughs were closed, these things were immediately documented. They've been shared. Those untoward events, many of them could have been prevented. I'd much rather focus my energies on prevention and quality. All of us would. I'm not going to talk about another medication error that happened that was preventable, where we violated JCO rules. Everyone supports matching the number of caregivers to patients. No one wants our hospital to be overstaffed. If we drop from 1,800 patients to 1,200 cases in our OR every month, why aren't we having the discussions on how to fix that? Where are these patients going? Why aren't they coming here? Why aren't you engaging us in trying to fix that problem? No, the answer is downsize. No one has heard these discussions inside the halls of Jackson. How do we get volumes up? I've gone to board meetings and suggested we would love to help you increase volumes. We have 10,000 employees here. Why don't you work with us to get these women here for mammograms, etc. Work with us to maximize the volume. Stop reacting to the downsizing. Another statistic that keeps coming up in the discussion is the length of stay for our patients. Since the furloughs in December, the length of stay has gone up. I think you've heard the exact opposite. This is their data. This is not my data. When Dr. Roldan was here, our length of stay was between 6.8 and a low of 6.1. It's been going from 6.8 to 6.1 for the last 18 months. In September, it was 6.4, went down to 6.12, 6.19. December, January, 6.3, 6.38. We're not going anywhere on our length of stay. I wish our length of stay was going down. It's a strategy to decrease costs. It's a good strategy. We would love to work on that. You're not hearing that. You're hearing length of stay is going down, and it's not. John Dorsher continues to report on the worst times in our ER. Numbers increasing by 30% in December with the furloughs. Nonsense to believe that we can deliver our care to our patients without detriment. Management reports volumes have dropped by 7%. FTEs have dropped in the last 10 months from around 10,800 to 9,800. These layoffs are proposing another 900 layoffs. We're going to be 20% down in 10 months on employees and 7% down on volume. We think that's going too deep. We're all for matching the volume with the employees. We want to say, yes, that's right. We just want to be involved in that. There's been no involvement. Why aren't we fixing the problems? Why are caregivers consulted during this significant reduction? Why are executives, chief nursing officers, directors of nursing asking the union to say, where's the cuts? What have you heard? How many in my area? These caregivers are not consulted. Why does the CEO take